Hello, today I'll be discussing utilizing mobile health to drive patient engagement. I will help you understand and define what mobile health is, help you discover how mHealth promotes heightened patient engagement while managing chronic diseases. You'll also learn and discover about 3 ethical issues related to mHealth and the current challenges with implementing mHealth successfully. mHealth or mobile health is a general term for the use of mobile phones and other wireless technology in medical care to educate consumers about preventative health services. mHealth is used for disease observation, treatment support, epidemic outbreak tracking, and chronic disease management. Mobile health technology is opening up new lines of communication between providers and patients, and that, in turn, is improving outcomes, streamlining care processes, and enhancing the patient experience and engagement. How does mHealth enhance patient engagement in chronic disease management? App-enabled patient portals allow real-time interaction between patients and providers, making engagement easier to achieve. 61% of people have downloaded an mHealth app in their lifetime. People want to know about their health, and providers, in turn, want to be able to access information in moments and be able to effectively communicate that back to the patient more quickly. Connecting patients to providers is empowering individuals with chronic diseases to better manage their health. Features that make mHealth apps more engaging. Patients express that they want their apps to be engaging and easy to use, educational, and most importantly, personalized to their specific condition. Here's an example of an mHealth app that is currently being used successfully. Twine Health, a HIPAA-compliant connected health platform, delivers an engaging and user-friendly experience to help people manage chronic conditions such as diabetes and hypertension, and aids in lifestyle interventions such as weight loss and smoking cessation. Although mHealth apps are widely successful and provide great tools for patient engagement, there are ethical issues inhibiting its success. People from lower socioeconomic groups may not be able to afford a phone capable of supporting the app or connecting with mobile or internet networks required to transmit potentially large volumes of data. Disease-related impairments may also interfere with the effective use of these technologies, such as motor skill impairments in patients with Parkinson's disease. The second ethical issue is personal data at risk, which is the biggest concern among consumers. The security of data via mobile phones cannot be guaranteed. Hacking of personal data from mHealth apps has resulted in medical identity theft and significant financial losses. 80% of the most popular health applications available on Android do not comply with standards intended to prevent the misuse and dissemination of user data. A 2016 study published in the Journal of the American Medical Association reviewed the privacy policies on Android's diabetes and heart apps. Researchers identified 271 apps and used 211 of them in their samples. 81% of those sample apps did not have a privacy policy. The last ethical issue is regulation of mHealth apps. It's imperative that the use of mHealth is based on rigorous evaluations of their effectiveness and safety. There is no current regulation of mHealth devices or apps, and no guarantee that they provide clinical accurate information. Despite the success of the Twine app in managing chronic disease, the company's early experience highlighted the customer challenges as we described earlier. The Twine team found that traditional primary care practices were impressed by the app's capabilities and functionalities, but often were not enthusiastic about adopting it. Most providers expressed concern that the patients would not truthfully enter their data into the app, and thus they stressed the need to continue to see the patients in their offices at regular intervals to monitor their health. Lastly, I'll discuss challenges in implementing mHealth, which the first is usability. Challenges could be as simple as the size of a cell phone screen, the font size or type of screen, color combinations used to display information, or efficacy of an individual to use cell phones for more than phone calls. The second, again, is data security and privacy. As discussed earlier, personal information is not guaranteed 100% safe. This in turn inhibits patients to download the apps or be truthful when providing information on the apps. The last is reliability. Reliability can be considered from a purely technical perspective, whether a device or app works when you want it to. The second element of reliability is the value of content programmed in the app. Many readily available low-cost apps are not based on evidence from research. Such apps may provide incorrect information, which users presume to be correct. Some of my recommended solutions that are, in order to be successful, developers should expand an approach to ensure that a customer's willingness to implement their app translates into persistent use of the app. Only with sustained use of chronic disease management apps have a chance of improving patient outcomes and reducing costs for the treatment of chronic conditions they target. Developers should also continue to develop easy, user-friendly apps and ensure privacy policies are in place and carried out to the fullest to ensure trust with the consumers using the apps. Thank you for listening today. If you have any further questions, you can contact me on LinkedIn. Thank you.